So Ala has actually started numbing already. We did this prior to the film just to kind of decrease on time. So we have applied a topical numbing agent all over her skin. When I do the microneedling treatment, right before I do the treatment, I wipe off only the area that I'm going to treat. I don't like to wipe off the numbing cream on areas I haven't gotten to yet, because then the downtime there will kind of increase the sensitivity once we get to that area. So we are going to start on Ala's forehead. She's been completely cleaned and numbed, like I said, and we are going to start on the forehead area. So the device that we are using is the skin pin. This is the only FDA-approved skin pin device, microneedling device in the market. This is a little bit of a lift serum here. This will just kind of help the pin kind of glide and smooth over the skin. Each client is unique. They have their own kit when they come in. This is the kit. And in that kit, there is a sheath to protect from any bloodborne pathogens. There is an individual needle device here and their own lift serum. So it's unique to each client. So we are going to start. So start with one area. You'll divide the face up, or the area being treated, you'll divide it up into several areas, and you'll treat one at a time. Soft, gentle strokes. You don't want to push too heavy, too deep. You can customize the treatment and go over areas that need a little bit more attention, kind of like the 11 lines in between the eyes, nasolabial folds, just deeper creases from sleeping on one side or favoring one side. With the skin pin, you can go very, very close to the eye, where other treatments you have to stay pretty far away from that orbital area. You'll notice that sometimes little blood spores will come to the surface of the skin. That is absolutely normal, and it's actually beneficial. Blood coming to the surface is a key component of the skin turnover, the rejuvenation, and the restoration of the new skin. After the treatment, you'll apply ice-cold gauze that's been soaking, just to cool and kind of comfort after the treatment, take some of the redness and the heat out. They'll feel like they have a sunburn immediately following. Make sure to encourage moisturizing throughout the treatment process, post-treatment process. You'll feel kind of dry. You will have some peeling, not intense, but moisturizing is key. So how is your first treatment? How do you feel right now?
I actually feel pretty good, and it's much better experience than I expected. It was very minimum discomfort. Was actually that vibration was very actually soothing. So I think it was actually great.
So how does your face feel right now? How do you feel?
The skin feels little like after sunburn, like a little hot, little tight, but I feel like it's very comfortable and very tolerable.
Good. And so normally directly after a treatment, you will feel kind of a tightness, like she said, like you've had a sunburn. When you walk into the elements, if you are exposed to heat, or if you get into a shower with steam or go to a sauna, which you probably should avoid, but if you're in those hotter elements, it's going to feel like you're walking into those with a sunburn. It's going to be increased heated sensation, a little discomfort, but that is completely normal, and that usually resolves in about 2 to 3 days. The redness will last about a day. The increased redness will last about a day. The second day, you'll start to notice that it's going to dissipate quite a bit, and then by day 3, you should be just nice and pink. That histamine reaction and that edematous process that's taking place, you'll get a nice glow like in the first week following the treatment. It's very, very important to moisturize throughout this whole treatment. Because we are basically resurfacing the skin and we've made those micro injuries, there's going to be cell turnover, which is going to increase the dryness of the skin. So when that new skin is forming, it is so very important to keep moisturized throughout, and also avoid the sun at all costs. You could be exposed to photosensitivity, and we don't want to contraindicate such a great treatment by exposing this new surface of skin, this new layer of skin, to the elements and to the UV rays. So moisturize, and definitely SPF.
Can it be done on my neck?
Yes. Microneedling is actually a treatment that can be done on pretty much any part of the body. Yes. So there are contraindications for getting this treatment. There are some people that definitely would not be a candidate, which is why a consult is very important. But those of you who have had any kind of scar, any kind of trauma where there is a scar, if it's less than 6 months old, we cannot do the microneedling treatment. We need that scar tissue to have time to heal and mend before we take over with the microneedling treatments. People that have eczema, psoriasis, people that have a history of keloid scarring, that would be contraindicated for this treatment, but it is very, very limited, or there are very limited contraindications. Most everybody is a candidate, but there are definitely a few that aren't. I know that it seems like I've given you a lot of information in post-care, but we will be giving you written literature, and you can go home with that. If you have any questions or concerns, feel free to call the salon and we can definitely go into it a little bit further detail. But very important, just moisturize throughout the treatment. Sunscreen, avoid the sun at all costs if possible, especially over the next 2 weeks. And then you can repeat this treatment on the same exact area in 4 weeks. So we want to give that time for new skin turnover, new cell turnover, for the time to heal. And then in 4 weeks, if she's like, I really love it, but maybe one more, I think it would be in good standing, then in 4 weeks we can treat that exact same spot. So